As a result of all these problems, the whole program more or less ground to a halt. So President Ford said, well, I will settle it. And he called a special news conference. In front of the whole America on television, he rolled up his sleeve and had his shot. But I claimed at the time that he had a false injection. Then he invited all the news media people that were present to line up and have theirs, and he had doctors ready and nurses with their syringes and so forth. And only one man volunteered to have it, and he was a White House press secretary. The rest refused to have it. It looked very bad. A few days later, I was due to leave America. I was in Boston, about to catch a plane to England. And I received a phone call from the Washington Post. And the reporter said to me, we've just found out who you are, Dr. Kalokerinos, with emphasis on the word doctor. He said he'd been told by the Australian authorities that I was unregistered, that I was in the pay of the pharmaceutical companies. Well, what could I say to him on the phone? It was absurd. Now, when it was all sorted out, I met the doctor who is more or less in charge of the testing of the vaccine. And it turned out that millions and millions of doses of the vaccine were prepared, but they tested bad. So they had to manufacture a new lot, but the time was running short. The vaccine had to be distributed. So they didn't test the vaccine that was distributed. And I think there was a program on television called, was it the Mike Walsh Show? I think that was the name of it. And I've got the transcripts at home. And they got the doctor who was in charge of the whole system and questioned him. And they asked him if the vaccine was tested. And he answered with, I never really answered. Sometime later, I met Dr. Morris, Dr. Tony Morris, who did a lot of the testing. And he told me that his test showed that the vaccines were not safe. And he handed in his report. The authorities didn't like it, so they sacked him. They destroyed his experimental animals, sacked half of his staff and dispersed the rest. He sued and won substantial compensation. And that man taught me a lot about the adverse side effects of vaccines. Now the question is, of course, he is the most powerful man in the world, the President of the United States, being advised that there's going to be a huge epidemic of swine flu. In fact, there wasn't a single case of swine flu. There never was going to be an epidemic of swine flu. The whole thing was called in the newspaper hogwash. So why was President Ford so advised? There are various theories, none of which can be confirmed. One theory is that President Ford's enemies wanted to get rid of him, and by making him appear to be foolish and stupid, this was one way to do it. And there's no doubt that that fiasco contributed largely to President Ford's undoing. Another theory, of course, is that the manufacturers of the vaccine were going to make millions and millions of dollars out of it, because I think, I'm not sure, but I think it was about that time that the United States government passed a special law that prevented individuals from suing the manufacturers of the vaccine. if they had an adverse side effect, they couldn't sue the manufacturers. They had to sue the American government. I think that's the way it was. Someone might correct me. I don't know why they started the swine flu vaccination campaign. I could think of several theories, none of which make real sense. There's an extraordinary episode, particularly in view of the fact there wasn't a single case of swine flu and there never was going to be a case of swine flu. And the rest I'll have to leave to your imagination. If you turn that off, was that right what I said?
No, because the compensation program was in '86, and it was really just, if I'm correct, was just the childhood vaccines that had been mandated by the government, and the swine flu thing was in the 70s, around 76, I think. Is that correct?
Well, I think I have some information to the contrary, but I'm not sure.
Well, it might be that there was something different going on that wasn't tied to that particular law. Maybe they had finagled their way into getting themselves protected. There may have been a separate law that I'm not familiar with.
Yeah, I think I'm right, but I'm not absolutely sure, and I've got piles of paper that thick, you know.
And it's hard to keep track of all this stuff.
So let's see, bottom line, if I were a doctor, I use vitamin C, am I going to save lives?
Yes, but you may also get yourself deregistered. I'm not sure what the situation is here in America, but the authorities in many places, in many countries, will jump on you very quickly and say you are using treatments which are non-standard, not proved, potentially dangerous. They'll take your license away from you, or they'll do worse than that. They'll come to you and say, well, we believe that your methods of practice are not up to scratch. In order to prove that you are capable of practicing medicine in a proper way, you are going to have to pass an exam. And they'll set an examination, the standard of which is so high that not even a professor of medicine could possibly pass it.
Okay, let's fix this hair there a little bit for me, Pamela.
There's
Give me the positive report on this. I mean, you're convinced that this vitamin C will work, and so that's what I want to hear is that, you know, it just, you've seen it over and over and over again, it saves lives.
Yes, convinced is not a good word. I know that it works because I've demonstrated it over and over and over again. As an additional method of treatment, it has remarkable effectiveness and benefits. There's no question about that. Over a wide range of disorders. The most obvious is acute viral infections. More complicated is the prevention of sudden infant death syndrome. It's of enormous value, a supplementary treatment for all types of cancers. And despite reports to the contrary, it doesn't prevent the beneficial effects of chemotherapy or radiation. In fact, it helps the anti-cancer effects of chemotherapy and radiation. I don't exaggerate its benefits in cancer, but it's very, very real. One of the first patients I ever treated with vitamin C had cancer all over him. He was told to go home and die. That was about 25 years ago. There's no trace of the cancer today. But I must be a little bit careful because he remains as one of the best results yet. But the average patient with cancer benefits in a holistic way. They live longer, suffer less, and die in a much more humane manner. Now that doesn't mean to say that we save everybody, but in my opinion it's criminal not to administer vitamin C, particularly by injection, to a cancer patient.
Okay, now when we come to Australia, will we, well, never mind that, but can we produce graphs and charts that will show that, okay, here was this little town and here was the infant death rate, and then you started using vitamin C, and here's a graph or a chart that shows how the infant death rate dropped dramatically? I mean, would that be a realistic chart that no one could attack for us to produce?
Well, unfortunately, I left the town in a hurry. I was never able to get to the records, and the records probably been destroyed. But one of the senior nurses who was there right from the beginning is in the town. She could talk to you, but I'm afraid when it comes up to hard data which you're looking for, we can't produce it. There's one other thing about that, though, that I lecture about this, I've written about it, I've spoken about it for years. And if what I'm saying is not true, the authorities would have jumped on me years ago. And they haven't.
What about newspaper articles? Are there that...
Yes, I have newspaper articles.
And do they acknowledge it?
Yes.
Okay, well that'll be helpful, I would think.
Mm.
Does any of the three of us have any other questions?
I have a couple things,
Okay.
yeah. One, I'd like you to talk about this whole issue of bowel tolerance and how that is a sign of, that with various diseases or disease conditions, your body needs more or less C, and that bowel tolerance is the sign of reaching that limit.
A doctor here in America by the name of Robert Cathcart observed something which I think is quite important. We knew, even before he started work, that when a patient got a viral infection or a sickness of any sort, that they could tolerate an oral intake of vitamin C in doses much greater than they would normally tolerate, because what happens if an individual takes a lot of vitamin C by mouth, it can act like Epsom salts, which is an osmotic effect in the bowel and cause diarrhea. It's not dangerous, of course, but it's not pleasant. During health, the average individual finds that they can take up to a certain level of vitamin C. If they go beyond that, they will get diarrhea. But if they get sick, say with the flu or whatever, they suddenly find that they can tolerate 3, 4, 5, 10 times as much vitamin C without getting diarrhea. And this is what Dr. Cathcart calls bowel tolerance. And it's very accurate, it's a very accurate observation and very true. So that when you get sick, you keep taking vitamin C in bigger and bigger doses until you start to develop diarrhea, and then you just cut back a little bit so you're not sitting on the toilet all day, and then as you improve and get better, you cut back a bit more and a bit more. It's a very accurate and very important observation.
It just made me think of another question. Talk about the issue of rebound scurvy from high doses of vitamin C.
I don't believe it exists, rebound scurvy. The idea is that if you take big doses of vitamin C and suddenly stop, that you'll suffer from scurvy much more readily. I don't think that really happens. But even if it does happen, it's a crazy thing, because vitamin C keeps you healthy and keeps you alive. Are you going to suddenly stop taking it and be sick? So even if rebound scurvy is a fact, That doesn't mean to say you shouldn't take vitamin C. If you take it to the extreme and don't take any vitamin C, you'll die anyway. So this idea of rebound scurvy is almost certainly not correct, but if it is true, one would be foolish to stop taking it.
I'm sorry, his eye line kept
Sorry,
going.
I didn't, sorry. Do we need to do that again?
No.
Bill had a question. Do you mind my asking that?
No.
About the vitamin companies? Why haven't the vitamin companies done studies or supported you more on this issue?
It just seems like there'd be some greedy vitamin salesman that would be out there beating the bushes and, you know, simply because he'll make a commission.
Yes, I remember one little thing. Linus Pauling appeared on television once and someone asked him, well, where do you get your vitamin C from? And he said, I get it from Bronson's. I think it was in a place called La Canada or La Canada or somewhere in California. Well, Bronson's, which was at the time a relatively small distributor of vitamin C, suddenly found they were sitting on top of $1 million. They got huge orders of vitamin C. But the vitamin C manufacturers are restricted as to what they, and distributors, vitamin C distributors are restricted in what they can claim. They can just more or less distribute without making claims. I can make a claim, but they can't.
That sort of explains.
That's what I was thinking, actually, after today, before I asked the question. Yeah, because they can get into a lot of trouble if they...
Yeah, well, my first book, which was Every Second Child, I think you've got it. It was printed in that paperback version for distribution in the States. The Federal Drug Administrators, Federal Drug, FDA, Federal Drug Association, is it?
Administration.
Told the distributor that it made claims to vitamin C that couldn't be substantiated. And they threatened to fine him with a huge amount, I think it was millions of dollars per week or something, if he continued to distribute. So he had to stop distributing it.
That's against the First Amendment. Second Amendment, First Amendment.
Well, the thing, you've got all these exercise machines on TV that'll, give you abs or whatever, and that's all a bunch of
Yeah, they
fluff.
let that happen.
Yeah.
Well, they're very selective, aren't they?
Well, and I think it's the power of the drug companies really, trying to prevent an unpatentable product from gaining any prominence over there. I want to just bring up something, and I'm not sure how we can work this in or if we should, but to me, what happened in Naples is like, kind of puts it all in perspective, that in a sense what happened there shows that the doctors, almost without realizing it perhaps, believe that you're better dead than trying vitamin C. How do we, is this something we want Archie to talk about, or that, to me this is the crux of it. Because here's, life and death, on camera, they won't try it.
It's a difficult thing to answer because I don't really know the answer to that. It disturbs me greatly. I've seen doctors die themselves
Talk to me, Archie.
rather than take vitamin C. I mean, themselves. They leave their children to die, their mothers to die. When my mother was approaching old age, she had arthritis. And she was admitted to hospital and she was in terrible pain. But she was under care of a very leading physician in Sydney who did not believe that people should take vitamin supplements. So she wouldn't take her supplements. And I went to see her in hospital and I sneaked a look at her x-rays and she had osteoporosis, something terrible. And she could hardly move in bed. And she was desperate. In fact, she really wanted to die. But in the end, she did agree to start taking supplements. Well, the response was dramatic. In fact, it's one of the best responses I've got from any patient, so don't get me wrong. I'm not saying you're going to get this sort of response from everybody. Within a few weeks, the pain had disappeared. She left hospital, went to a home in the suburbs, used to catch the bus, go to the city, do her shopping. No trouble at all. And then she decided that she would go back to where she was born in Greece for the first time since she left as an 8-year-old girl. And she had a few medications that she took routinely. And I went through them with her to make sure that everything was all right. I noticed that she didn't have any painkillers. And I said, do you need some of those tablets for pain? She said, no. And I said, don't you think you should take a few just in case? And she said, no, I don't get any pain anymore. She refused to take them. So yes, occasionally you do get a drama of response like that. But if she had taken her supplements many years before, she would never have ended up in hospital like that. Now that's an extreme example. And as I said, I don't always get a result like that. But when you do get it, it is very gratifying. I believe that everybody should take vitamin and mineral supplements.
This poor man's been doing this for
Okay.
3.5
Yeah.
hours.
Is there any question, we always ask this at the end of an interview, is there any question that we should have asked you that we were too dumb to ask you?
Well, I think a short session on Aboriginal deaths in custody.
Okay. Better fix your hair. You just did that thing to it.
The camera's rolling.
You were going to tell us about Aboriginal deaths in custody.
Aboriginal deaths in custody was a serious problem while I was working amongst them. They would be found dead in their cells. And authorities invariably claimed that the deaths were due to suicide. But I was asked by families to investigate because they didn't believe that suicide was the cause of death. My experience actually started long before that. In Kalokerinos, the police were paid extra when the cells were full. They were paid as lock-up keepers. So they used to raid the Aboriginal reserve and arrest anybody drunk or sober, throw them in the cells and charge them with alcohol-related offences. And I got very angry about this. And I went to the sergeant of police who was in charge and said, look, for every Aborigine who is arrested and charged with an alcohol-related offence, there should be a white supplier charged for supplying, because at the time Aborigines were not supposed to be allowed to drink. It was illegal. And the sergeant said, well, we can never get a witness. Well, shortly afterwards, I was down the main street one morning and I saw a white man supplying alcohol to an Aborigine right in front of a group of young Aboriginal kids who were on their way to school. So I went straight round to the police station and said, you've got your witness. And he refused to take action, which made me very angry. And one day I was driving up the main street of Kalokerinos slowly. I might have told you this story. I'm not sure. Did I?
Maybe. Two guys fighting?
Yeah.
We have that one.
Yeah.
Sure.
Well, I'll tell you the rest of it then. I was asked at one stage by a family to investigate the death of an Aboriginal man in the jail in Sydney. He was found with his throat cut. And the authorities said it's suicide, but his family didn't believe them, so they asked me to help them. So I went to the inquest with the family. I was sitting in the courtroom waiting for the inquest to start when who should walk in, representing the warders at Long Bay Jail, for the son of my first cousin. Not a nice man. He saw me and obviously recognised me. He knew me as well as he knew himself. He didn't say anything to me, but he approached the coroner who had just entered, sat down, and whispered something in her ear. And although she hadn't actually started the inquest, she said that there was some problem with the sound system and we would have to wait. So we were kept waiting there, I think, for about 2 hours. When she came back and started the inquest, the first witness was the doctor who did the autopsy. In his written report to the court, his description of the wound in the neck was very short. There was no detail concerning the nature of the wound at all, and just a few short sentences. But in the witness box, he started to talk about all sorts of fancy things. The main one of which was, he reckoned, that he saw tentative cuts. Tentative cuts are made by someone who's about to commit suicide. They make a few little cuts first until they get the courage up to make a big cut. So when you see those tentative cuts, it's almost totally diagnostic of suicide, whereas with murder it's one quick slash. So when my turn came to give evidence, I asked to see photographs of the wound. They had plenty of photographs of the body, blood all over the walls and everywhere, but they claimed they did not have photographs of the wound. So they asked me why I wanted photographs of the wound, and I said, well, 9 times out of 10, you can tell the difference between suicide and cutthroat by looking at the wound. And they persisted in saying that photographs didn't exist. Well, I was very angry about that. The verdict of suicide was handed down. More than 20 years after that, reports on the case were posted on the internet under Google. The death of Peter Leonard Campbell, Aboriginal death in custody. A group of very senior forensic pathologists made comments about the case. There's no mention whatsoever of failure to produce photographs of the wound. They more or less said something to the effect that Archie Kalokerinos was off his head, didn't know what he was talking about. You can read those articles, they're still on the internet. Peter Campbell, Aboriginal deaths. Leonard Peter Campbell, Aboriginal deaths in custody. Now, anyone reading that would think, well, these people are so dignified and so highly qualified and so important. I mean, they've got to be right. Kalokerinos must be a bit strange. Now, my real problem, though, is why publish that more than 20 years after the event? I can just assume that they really wanted to destroy my credibility, and that disturbs me.
Why would they want to do that?
Because there are a few other cases that I was tied up in too. And I assume that they're afraid that if I had credibility as a witness, that it would make things difficult for the authorities to say that these deaths were due to suicide. I mean, another case that I was asked to investigate by a wife, this young Aboriginal man was found, and high up in the ceiling there was a grid, metal grid, but it was a very fine grid. And they reckon that he threaded something through that grid, I can't remember what it was exactly, and hung himself. Well, I saw photographs of the cell and the grid. There's no way in the world that he could have reached up and hung himself. Now, I do know that Aborigines do commit suicide in jail, but every case that I investigated suggested very strongly that it wasn't suicide, that it was murder. They had a royal commission into Aboriginal deaths in custody. Millions of dollars, I can't remember, 40 million or something, was spent. On another case, I had sufficient evidence to put several police in jail for a long time. During the Royal Commission, I was permitted to give evidence. The Commissioner I knew well. He used to be Professor of Law at one of the universities. One of my cousins worked under him. Before I opened my mouth, I was told that I'd be only allowed to speak about one little point and nothing else. That my entire evidence would be suppressed at the time and not allowed to be published. Everything that was said on the day before I appeared was published in the papers. Everything that was said on the day after I appeared was published in the papers. There's no explanation whatsoever offered as to why this was so. And all that other evidence that I had, which, as I said, would have put half a dozen policemen in jail for a long time, was not permitted. Eventually, when the Royal Commission handed down its findings, not a single individual was charged.
Do you want to tell us now what wasn't allowed to be published then?
Yes, for example, one case where I was called to see a dead Aborigine in his cell. I did the autopsy, he'd had a heart attack. He was charged actually with alcohol-related offences, but he was a teetotaler, he never drank. I wrote out the report, coronary occlusion. I was pulled out of bed in the middle of the night by the sergeant of police who drove nearly 100 miles across to see me. He sat down opposite me and he said, "Now, Dr. Kalokerinos, I'm reconsidering it. Don't you think that there's alcohol in his stomach?" And I said, "No, there wasn't." He said, "I want you to change your statement and say that there was." And I refused. And he said, you know, we can make life very hard for you here, Dr. Kalokerinos. And I got so angry, because I was fit then, I picked him up and threw him out physically. You see, they were some of the people who should have been charged. On another case, person responsible for the death should have been charged. I had the evidence, wasn't. But you see, I wasn't allowed to even talk about these cases. This is a democracy, Australia. Obviously, they didn't want anyone to hear what I had to say. And I find that very, very disturbing.